It's an orgasm. Every woman can learn how to generate orgasmic platforms and triggers so that her orgasms are predictable, enjoyable, and that can be triggered on demand. You don't have to depend on somebody to give them an orgasm. This intense feeling of pleasure, where the brain also goes into a trance state. The word orgasm actually comes from the French word called la petite mort, which means small death, a little death, because that's exactly what happens at the peak of orgasmic pleasure. The DSM-5 describes orgasmic dysfunction. It's a clinical diagnosis. Okay, so there's either delayed or infrequent or absent, markedly diminished experience of orgasms in spite of stimulation, in spite of a subjective arousal. And this is very important, that it's subjective. It causes distress to the person. So if the person is not complaining that they're not getting orgasms, it's not a problem. So the person has to complain that not having orgasms is personally distressing. And they've tried things to solve it, and it hasn't been solved, and the problem has persisted for more than 6 months. The truth is that sexual pleasure, especially orgasms, are linked to a better quality relationship, a judgment of a better quality experience by women. And unfortunately, female orgasms were never given the importance they were due, because way back in evolution, women didn't orgasm at the same time as men for a reason. And the reason was that orgasms release oxytocin, which is a bonding hormone. It makes you attached to the person you have orgasms with. And for a lot of the time, those days, men lived very short lives because they were hunters, they went off, they were attacked, and you couldn't get attached to somebody who wasn't going to be hanging around for a long time. So there was a purpose for why women didn't orgasm that frequently. And there was also a purpose why men had to orgasm. And for a big reason, a lot of men's performance problems are related to them being orgasmic or not, and women's aren't. So women can still conceive and become pregnant even though they're not orgasmic. Unfortunately, this got taken a little bit askew in the Middle Ages, when a lot of men believed that women could not get pregnant unless they found pleasure in the activity. And so a lot of rapes went without getting any justice, because if a woman got pregnant and she was raped, it was assumed that she had pleasure when she was raped. Today, thankfully, that's not the case. There's so many benefits of orgasms that women should not be denied an orgasm. Truly. The sheer pleasure of being orgasmic, the world looks a much rosier place. Women who are orgasmic are actually happier people, they're better to be around, they make better leaders, they make better decisions. Why wouldn't a woman want to be orgasmic? Women who are orgasmic experience much lower levels of chronic pain or distress. They have lower incidence of urinary incontinence. And women who are orgasmic, especially when they're menopausal, have lower menopausal symptoms simply because of the boost of oxytocin. And remember, oxytocin levels are inversely connected with cortisol levels. So the more orgasmic you are, the less menopausal symptoms you're going to have. The more pleasurable your journey through menopause will be. Guess what? Your sexual health is directly connected to your cardiovascular health. Your cardiovascular health is directly dependent on your autonomic nervous system. Your autonomic nervous system's well-being is its ability to flip between fat burning, sugar burning. Your autonomic nervous system's flexibility and strength to switch off the stress response is what determines your cardiometabolic and endometabolic fitness. When your cardiometabolic fitness is great, your sexual function is great. Women athletes, female athletes, have 30% more clitoral blood flow than non-athletes. If you're orgasming, you also have much higher oxytocin levels, lower cortisol levels, better immune function. Who needs a doctor? Who needs an apple? You just need an orgasm a day. Unfortunately, today, in a lot of couple relationships, women take as much as they take to orgasm. There's no such thing as women take longer than men. It's just that men don't bother about the women they're with. Women take a certain amount of time to orgasm because that's their physiology. They can build on it, they can train themselves to orgasm better, faster, more reliably, but that doesn't mean they're taking longer. That's a misnomer. It's the wrong kind of questions to ask. The reason these statistics come about is that, most of reproductive biology, history, all of our testing is dependent on making women get pregnant. Sexual pleasure for women is only a recent kind of resurgence where they're given their right. Not even 100 years ago, women demanding pleasure, even today, women demanding pleasure is seen as lustful. Oh my God, she wants to feel pleasure during sex, then what is she thinking? And that age, The problem is, when women are with women, they orgasm much more often than they're with men. Men take the orgasms for granted, women don't. Women in homosexual relationships, and I'm describing women as those with vulvas, are much more likely to orgasm. There was a study which was done amongst youngsters, young heterosexual adults, talking about the orgasm gap and what do they think are the reasons this gap exists between men and women. And they correctly identified themes relating to socio-cultural issues, the sexual rights, the scripts that we follow, the kind of programming we have, how we're taught about women's pleasure, what are we taught about women's bodies, what are we taught about women's genitals, what are we perceived about the men's role in women's pleasure? He doesn't do it right. Did you tell him what makes it right? Have you ever thought about communicating what you need or what? But I can't, he won't let me. All of these scripts are programmings that stop women from taking pleasure for themselves, for accepting responsibility also for inhabiting their bodies. Now, if you compare women, and there's a lot talked about the clitoris and clitoral orgasms and penovaginal intercourse and penovaginal orgasms, but truly, if you remember the first orgasmic experience or any other mind-blowing orgasmic experience you had, then you know that it's a whole body thing. It's not just about the clitoris, it's about the nipples, it's about the scent, it's the scent, it's about the beads of sweat, it's about the trembling of the muscles. All of this is part and parcel of the orgasmic experience, which then, of course, when it's studied in research, forms this 4 nerves and 6 hormones pathway, because oxytocin is not just a hormone, it's also a neurotransmitter. And all of the pathways leading right from the clitoris, the penis, the inside of the vagina, the urethra, the perineum, the anus, all of these, and the nipple, the mouth, the lips, the neck, all of the other erogenous zones leads to becoming orgasmic. And this is what's called an expanded sexual response. And we know that women who train themselves or enjoy during their masturbatory experience or self-pleasuring experience, permit themselves to have expanded sexual orgasms, are much more likely to experience orgasms even with their partner, and much more likely to have body confidence that allows them to teach their partner what makes them orgasmic. So when we look at the anatomy of the clitoris, we now understand a lot more that there is no such thing as just a clitoral orgasm or just a vaginal orgasm. Because the complex of the clitoris actually envelops all of the entrance of the vagina and the vulva. This complex, and even the tissue around the urethra, all of this is responsible for the erogenous content, the lubrication, the increased sensitivity. And each woman is different. She has to learn about her own clitoral-vaginal complex. How does it respond? And that can be built better when her whole body is stimulated, when she's relaxed, if she is willing to experience the expanded sexual orgasm system, then she understands what's the best way to touch her clitoris, and then she can communicate it with her partner. And there's a whole thing about G-spots and the C-spot and the A-spot, and all of them are ways to stimulate this erogenous zone. What's important important is that as women start to go through menopause, which becomes an important area of an orgasm, it's not the only one, we'll talk a little bit more about inhibitors of orgasm, is that the clitoris can become dry, the hood can start to become fused, and it becomes less responsive and less sensitive. So we know that vaginal estrogen is very helpful, but also stimulating the clitoris frequently, at least once in every 2 weeks. Making sure that the area is clean, that the hood is clean, just plain water, not with soap, can be really useful in making sure that the clitoris retains its sensitivity, that it retains its ability to become erectile. So there's lots of inhibitors of orgasm. The scripts, the sexual scripts, expectations of the partner. So even a sarcastic comment like, "Oh my God, you take ages to come," and then that can switch that woman off from ever coming and have experiencing an orgasm with that partner because the weight of expectations is so high. And it can be negative emotions, previous pain or disengagement. Like Dr. Anita just taught us how to come back into the body. Disassociation from the body in order to escape traumatic experiences, memories, sensations is a very common factor in anorgasmia and poor arousal. Having problems with how the body looks, body image issues, perspectives on your entitlement to pleasure, and some medicines, of course, antidepressants, many psychiatric medications we use, even antihypertensives, patients who are diabetic, all of these complexes can interfere with the orgasmic process. When I teach my patients, I often talk to them about the brain-body gentle connection. You can create breaks between the brain and how your body feels simply by getting very angry or upset with somebody because they said something. If you keep thinking about what made you angry or upset, you're not going to feel the subtle sensations of orgasm and pleasure. The genital sensations of arousal also don't have a pathway because there's a feedback loop. If your genitals don't feel wet and aroused and turgid, and you don't recognize that, you're not going to permit yourself to meet and complete the orgasm in your brain. So when you look at medical conditions, natural surgical menopause, and the cause for that surgery is also important. So whether it was fibroids or endometriosis, heavy periods, whether it was prolapse, birth injuries, all of those things that end up leading to surgery, cancers, that can cause anorgasmia. Many endocrine problems, including things like diabetes and hypothyroidism. When women are not aware of how their genitals respond, psychological problems, depression, anxiety, financial problems in a couple relationship, things that cause a lot of arguments, all of these can result in anorgasmia. And largely it's not because they are understimulated, it's because they are not inhabiting their body, they're disassociated with the body for whatever reason. So then that leads you to how should you assess these women in a laboratory? Like what lab test would you do? For sure, you want to rule out any kind of metabolic disease. So diabetes, obesity, hypertension, all the inflammatory conditions. You want to make sure you rule out any of the common hormone deficiencies, especially thyroid dysfunction. You want to identify and treat nutritional deficiencies. And you want to get them moving. Their cardiovascular health is really important. So if they're unfit and sedentary and they have orgasmic problems, more than likely helping them to get moving and exercise. And remember, they won't feel like exercising until you top up their nutrition. Until they are nourished properly, they're not going to have the energy to get moving. If they're severely anemic, then orgasms are the least of our problem. She's having heavy periods. You need to fix the cause of what's causing the problems first. Several myths about orgasm need to be addressed when we're going through the consultation process with her. And many times women will not complain of anorgasmia. They'll just come, you'll have a couple and say, oh, she's just so irritated all the time. Nothing I do seems to work. You keep banging away. Say, what else are you doing? How else are you encouraging her to own her orgasm? I mean, blame, shame, guilt, criticism isn't getting you there. You know, have you tried a little tenderness? Probably not. That's why. Engaging with the partner in the relationship process is just as important. Many men will complain that their wives don't allow them to see them. So they're having sex in the dark, everything finishes. And guess what turns a man on? Seeing his partner getting aroused with his lovemaking is what turns a partner on. Seeing his partner enjoy his lovemaking is what gets him turned on. It was never and is never about the woman being afraid to expose herself. So what makes great orgasms? It's not just masturbation. It's not about being in new relationships or trying multiple relationships. Actually, when we look at the research, we see that partners skilled at orgasms improve the longer they are with in a particular woman, in a longer relationship. Because when the communication is open and the attitude is one of growth, so then they're much more likely to accept suggestions and learn from each other what makes her and him orgasmic and what brings and excites and increases the pleasure between them. A woman who is able to own her body, inhabit her body, is much more likely to become orgasmic and recognize the orgasmic triggers and platforms that will allow her to master her orgasms. And then, of course, communicating your needs. So if she's anemic, if she's unwell, then being able to visit the doctor to actually get that panel of tests done and get the problem fixed is also something that's important. There is a priming effect in orgasm, and particularly for women, the permission, and that's why the Plicit model works both in vaginismus and in anorgasmia, is because the permission to talk about their body, what turns them on, what can bring about a recognition of orgasmic triggers and platforms and have a bank of them. See, the only reason I remember that experience of the Ferris wheel, which I personally actually hate, I don't like rides, the only reason I remembered it because I wanted to create a talk where I could remember orgasmic triggers. The same thing goes with your first bicycle ride. The same thing goes with you when you're maybe doing your first trip on a camel and the clitoris gets stimulated, or you're doing your first bicycle ride and the clitoris gets stimulated, or you're on a horse and it's amazing. So remembering orgasmic triggers and platforms or previous great orgasmic events can form great platform from which to launch sexy thoughts, sexual thoughts, and then trigger your orgasmic response. There is such a thing as exercise-induced orgasms. Improving nutrition, well-being, function plays a big role in improving cardiovascular fitness. Learning techniques to improve partner communication and engagement. If you're menopausal or if they are in pain or discomfort, getting treatment for that will work. Especially things like vaginal estrogen is very effective. Using sex toys. Now, there is a huge variety and engagement, different kinds of sex toys, particularly those that use clitoral stimulation. And it's easy to assume that it's just the vagina and the clitoris that will give the orgasm. And yes, direct clitoral stimulation is responsible for a lot of women becoming orgasmic. But more than that, that expanded sexual response we talked about, that would be a much more effective way of helping a woman to become orgasmic, even with a sex toy. And it's seen that when couples include sex toys in their lovemaking, they're actually a lot more successful at helping the women they will become orgasmic and to manage the anorgasmia. There is an AI-powered vibrator. It's called the Lioness, and it will teach you what kind of orgasms happen to you. We know from the studies in the Lioness that women experience one type of orgasm in preference to another. So you can have something like some waves, so waves and waves of orgasms coming. You can have an avalanche, so there's a huge build-up and then there's a slide. You can have a volcano, so there's a build-up of pleasure and then there's a sudden explosion of pleasure. There was a patient who came to me and she was really afraid of orgasming because she said, oh, once I have an orgasm, everything's going to finish because he's going to just turn over and everybody's going to go to sleep and then I don't want it to continue because I get so tired afterwards. I said, have you ever wondered that you might be, that you could teach yourself to be multi-orgasmic? She says, oh, I didn't know that. I said, yeah, this is how orgasms work. Women are multi-orgasmic. It's like waves. When you're walking on the beach and your feet get wet with the ocean wave, you don't hold on to the wave, do you? You just let it come and let it go. And the next one comes and lets you just let it go. And the next one comes. Just, okay, that's how you do it. And the next time, she wasn't that bothered about her orgasms coming and ending sex. She actually learned to ride on the pleasures and raise her plateau of excitement so she could experience multiple orgasms. The truth is, and I quote from Esther Perel, most couples forget that everything they do between one orgasm and the next orgasm is sex. And that's what erotic couples in long-term relationships need to understand. Everything they do, including touching, inhabiting their bodies, for everything, whatever they do, appreciate, compliment, love, kiss, hug. And David Schnarch, in his Crucible approach, has talked about the 1 minute deep hug, which appreciates your partner in that deep hug, where you can feel the skin, you breathe the scent of your partner. You feel so deeply that you can feel the hug. And that's a good orgasmic platform to build up from. Thank you.
Thank you so much, ma'am. Any questions?
I'm referring to O shots, which were devised by Charles Brunel, and you know PRP injection into the clitoris and the body and around the urethra. So, what are your comments on that? There was also a statement written by you that. Okay, I'm forgetting that. Let's answer that.
You mean, what do I think about our shots?
Yeah, because the mechanism he said was it is regeneration of the nerves,
yes,
you know,
nerves
and the statistics are that 30% of the American women they do not get a vaginal orgasm. You know. So
I don't believe that.
yeah,
We know from studies that women between the ages of 18 to 25, 26, less than 30% of them will orgasm because they don't know how to. But the same statistics of women as you reach the age of 50, over 65 to 70% of them will have learned how to orgasm. So what we say is women haven't learned how to orgasm yet. It doesn't mean they're completely anorgasmic. There's less than 15% of the female population. I think they are only because they haven't learned what I've talked about. And yes, I agree with you with the O shot and all that. It is important because what the clitoris responds to is vascularity, which is where overall, you talked about correct nutrition, fitness, getting cardiovascular stuff, getting all of the other complicated stuff out of the way. If by that time, the clitoris, especially as you go through menopause, the clitoris and the areas become very dry and atrophic, it will respond to these regenerative therapies much better. And you'll see a difference because the absence and then the presence will create a difference that is noticeable. In a younger woman, I don't think it makes any difference.
sure. And I was referring to the squirting, you know, when you mentioned that.
Yes.
Because is it the urine from the urethra which squirts, you know?
No, there is the skin's gland.
Skin
Skin's glands, and it becomes.
But
And in women who have a very rich supply of skin's glands, that creates secretions, and then that comes out as secretions, and then that disappears as they start to go through menopause and aging. For them, it's very obvious, and they will rely on it as a symptom, saying, "Oh no, I'm not orgasmic. Everything's gone to pot, everything's become really dry." So that's how they complain.
So the third stage of orgasm is ejaculation and squirting with people. So
It doesn't happen to everybody.
because the first is congestion and second is the
But the
orgasmic feeling.
ejaculation and squirting is not a constant for women. Some women will experience it. If they experience it regularly, they come to associate it with their having an orgasm. And that's also a problem because it's not necessary.
Thanks for your excellent and enlightening. I never heard so lucid because it's so complex. This vaginismus, dyspnea, they are really very complex things to treat, and you have made it simple. All said and done, I believe the orgasmic experience is also very linked to the passion involved between the couple. And I don't think there is a medicine to create that passion. No matter what coach, surrogate coach, this coach, that coach, whatever you do, the passion between two individuals, it has to happen. It cannot be through medicine or through whatever it is.
Yes, sexual attraction, chemistry, but there is a problem sometimes that sexual attraction, chemistry can be mistaken for intimacy. And unfortunately, that's not always the case. A couple, and we talk about long-term relationships. Short-term relationships, it doesn't matter. But in long-term relationships, a couple has to go through the ebb and flow of rebuilding intimacy, recreating.
Because you cannot
pleasure.
have that level of passionate intimacy every
No, it
time.
doesn't happen all the time.
It doesn't happen. That is what the couple involved should be
They have,
made to
to, they
understand.
have to know and they have to plan into their life goal and vision. So I talk a lot about this 360-degree planning of our life. We're not just focused on intimacy. You have to get, if you don't have your finances right, if you don't have your health dialed in, if you don't have your career goals, if you don't have your life vision dialed in, it's very difficult to plan a life with a companion, and your sex life becomes part of that plan. How are you going to address it when difficulties happen? How are you going to address it when health challenges happen? How are you going to address protecting your sexuality, sexual experience, your orgasmic experience? Because there are so many benefits of becoming orgasmic for women. So how are you going to protect that when ups and downs of life happen? And that's for the couple intimacy, that emotional intimacy, that sensual intimacy, that intellectual intimacy comes into play to keeping passion alive in long-term relationships. And certainly I would refer you to Esther Perel's work. She's done a lot of work on this. It's called Mating in Captivity. It's one of the
I
key books.
prefer to refer such cases.
Your experience with the cell denial in women, do you
No, I don't believe in it.
you don't prescribe for?
No, I don't. My friend who's a fertility expert prescribes it for endometrial thickening and for IUGR. But I don't believe in it for sexual medicine.
So-
There was a marketing campaign for chemicals like nitric gel and bismuth for increasing arousal, especially lying around the clitoris. But you can get the same effect or better effect with vaginal estrogen and your fingers and a good partner technique.
Just want to add to that. Women don't respond to cell denial, or there is
It's the same as men. Without stimulation, you don't get anything.
What about EBT? Because when they come with dryness, vaginal effervescence is a tablet, intravaginal instead of sildenafil, dose of 25 mg.
Estrogen works better.
I can answer your question.
Yes, ma'am.
So,
Sometimes we are forced to give something for the women.
I would totally agree with Dr. Neelima here that intravaginal sildenafil does not work to achieve either arousal or orgasm. It is only given to increase endometrial blood flow if we are wanting a good implantation or IUGR, but it has no role in women's, and that is why it is not approved by FDA.
oral cell denial?
Oral is also not approved by FDA. The
Oral
pink Viagra never got approved. It is just a marketing gimmick.
And only one thing like vaginal dryness. So does it increase the blood flow? That's what I want to ask.
Estrogen. Estrogen cream is the answer, and a non-irritant lubricant just before sex. We give this to all our women. They can use a non-irritant lubricant like KY jelly, Lubic jelly, and that works perfect.
Which is the best estrogen preparation?
Oh, there are many. Evolon cream is one of them.
What will you prefer?
Evolon cream is one of them. It has a low dose of estrogen.
In India, you have creams available. But
You have estradiol, you have estriol, you have many.
In the US and the UK, you can get rings and tablets as well. So both work.
Lovely presentation, Dr. Deshpande. But two cases which comes to my memory. One case was of a 75-year-old lady with her 80-year-old husband. After a very long time in their life, they went on a vacation on a beach, and this was the first time she experienced orgasm, because this was the first time ever the husband and the wife were intimately involved for a very long time, did a lot of fingering, squirting happened, and she experienced orgasm at the age of 75. Proving your point, intimacy, connection, bonding, very important in the couple. Second patient which comes to my memory is my first patient at BMC, the Boston Medical College. And this patient was a young patient, comes with her boyfriend, and she says, I have not experienced orgasm. And my teacher, Dr. Monari, says, of course not. You will not experience, because anatomy, which is the way the women are made. Many, almost the statistics says, lot of women, especially above 70 to 80% women, do not experience orgasm with penetration. because there's no way one can, if the man is on top, they can touch the clitoris. The only feeling females can get is the female, the sensation of containment. Now, what are the other 20-30% of women experiencing? There are various positions which are taught to the couples or the couple, they're experimenting, and that position touches the clitoris, they can experience orgasm while penetrative sex. Besides that, there are 11 and more different types of ways where women can experience orgasm without penetration. So there are a lot of techniques, including pleasure accessories, positions, use of lubricants, use of various accessories, BDMS, everything, and women can experience orgasm without penetration. Thank you.
Thank you. Thank you, ma'am. Thanks a lot. Yeah, we'll go on.